Dr. Peter Calabresi is the director of the Division of Neuroimmunology and the director of the Multiple Sclerosis Center at Johns Hopkins Medicine, focusing on the diagnosis and management of MS. He's a principal investigator on several clinical trials and oversees research projects focused on creating new anti-inflammatory and neuroprotective therapies for MS. Welcome to the 2025 ACTRIMS Forum, and welcome back to Real Talk MS.
Thanks, John. It's good to see you again.
We last had an opportunity to talk a few months ago at ACTRIMS, where you co-chaired the announcement of updates to the McDonald criteria for diagnosing MS. Can you explain what the McDonald criteria is?
Sure. The McDonald criteria are a set of guidelines that clinicians use to make the diagnosis of MS. And it's important to have specific guidelines because prior to their evolution, people would just make MS diagnoses randomly, and so there was no consistency. And it's really important to have that codified so that we all agree on what is MS diagnosis. And these criteria keep being revised every 5 or 6 years, which is important. And most recently, we've incorporated some new technologies that increase the sensitivity and the specificity, so we can pick up cases earlier and be sure that they really are cases of MS and not something else.
That's what I was going to ask you, if you can maybe touch on a couple of areas that have been updated and what the benefit is.
Absolutely. So one of the major updates is incorporating advanced magnetic resonance imaging, or MRI. And so we now have MRI tools that can look at those white spots that we know are associated with MS and tell us the likelihood that that lesion is an MS lesion versus something else. And we know that head trauma, migraine headaches, vascular insults can cause white spots on the brain MRI. But if you see a central vein in the center of that, it's much more likely to be an MS spot, especially if you have several central vein lesions. So that became a major part of early sensitive and specific diagnosis for MS. Another one is the phase rim lesions. Those are lesions that are more chronic but have a certain signature on them, and they may have prognostic value as well for progressive MS. And these advanced imaging tools are being used in clinical trials, and so that's all very exciting.
I want to switch gears a little bit and ask you to explain what a biomarker is, and maybe tell us how close we might be to having accepted reliable biomarkers in MS.
A biomarker is something that someone can use to track the disease process. And when we're seeing patients, there is some variability in the information that we may get. Some patients are more extroverted or introverted, and clinicians examine patients differently. So believe it or not, the art of medicine is somewhat variable. So having a quantitative measurement is extremely useful when you're diagnosing a disease or tracking the disease process. And so biomarkers overall include imaging, like magnetic resonance imaging or imaging the back of the eye with optical coherence tomography, but they also can include fluid biomarkers in the spinal fluid and now in the serum or plasma of the bloodstream, which is much more convenient and easier for people with a disease process.
Certainly. What do you see when you look at MS research today that excites you?
I think the most exciting thing going on in MS research is that we're really on the cusp of solving the progressive MS problem. I was there at the beginning when there were no therapies, and then when early on in my career we were fortunate to have the interferons come out, and now we have high efficacy therapies for relapsing MS. But every week we see people who are suffering from progressive MS, and we just need to crack that nut. But I'm very optimistic. I think the groundwork has been laid over the last 10 or 20 years, understanding the biological mechanisms that underlie progressive MS, and now we're starting to see positive phase 3 trials working in non-inflammatory forms of progressive MS. And so for me, the proof of concept that just came out last year at one of the reports at ACTRIMS is one of the most exciting things going on right now, and I think it's going to just lead to better and better therapies, much as we had with relapsing forms.
I would agree. I see that as a game changer. So we're here among 1,800 attendees at the ACTRIMS Forum. What are your impressions of the meeting?
Oh, I love ACTRIMS. It's a great meeting. It's very manageable. I was involved in the early days of deciding whether it would be a gigantic meeting like ACTRIMS or whether we would keep it single track. We've really resisted the temptation to go to parallel tracks, and I think what's really nice is that You have a grand ballroom where you have basic scientists, translational people, and clinicians all together, and that's really important. And we can all stay focused on one topic at one time rather than trying to move between rooms and have problems with attention deficit. And so the ACTRIMS meeting is great and get to see lots of people. It's wonderful for catching up with old friends, making new acquaintances, and forged so many new collaborations and alliances in the last 4 days that I can't keep up with it all.
Well, it certainly makes for a less frantic environment, doesn't it?
It does. Absolutely.
Well, Dr. Peter Calabresi, I want to thank you for all you do to improve the lives of people who are living with MS. And once again, thank you for talking with me today.
It's my pleasure. Thank you.